Hi, in this video, I'm going to talk about Medicare Part A. So Part A, I'm talking about the premium, and later when you receive the service, the deductible, copays, and the other thing related to Part A. So Medicare Part A usually is considered the premium free. So premium Medicare Part A helps pay the in-hospital expense. So Part A coverage is provided for most people without premium, as long as the individuals or spouse, you can see here can count as a spouse as well, has worked in covered employment for at least 40 quarter 10 years. There's no premium for Part A coverage. So you can see for the Medicare, you are when you were young, you have a job, you pay 1.45%. Right now is in 2021. Pay into the Medicare. If you are self-employed, it's 2.9% to pay into the Medicare. So that is for you paid in. So that's why your Medicare Part A is free of premium. So then for those, so for you have to be fully insured, which is at least 40 quarter 10 years. Those pay into your Social Security Medicare tax. So then you are qualified for the Medicare Part A premium free. So for those who are not contributing into the Medicare system for at least 40 quarters, and then the monthly premium vary based on the amount you have contributed, and the table is set each year. Okay, so let's see here, just say what's the Part A cost. Here is from the Medicare website. This you can see is medicare.gov. So they tell you, say, premium free Part A. So you usually don't pay monthly premium for Medicare Part A hospital insurance. This is hospital insurance coverage if you and your spouse paid the Medicare taxes for a certain amount of the work, which is the 40 credit 10 years. This is something called premium free Part A. They tell you is premium for most people get a premium free Part A. You can get the premium free Part A at age 65. You already get retired benefit from the Social Security or the Railroad Retirement Board. You are eligible to get Social Security or the benefits but haven't filed for them yet. You and your spouse had Medicare covered government employment. If you are under age 65, you can get a premium-free Part A. If you got Social Security or Railroad Retirement Disability benefit for 24 months, you have a end-stage the kidney disease to meet the certain requirement. So Part A premiums. This is Part A premium. Say if you don't qualify for the premium free Part A, you can buy Part A. People who buy Part A will pay premium either $259 and $471 each month in 2021, depending on how long their spouse have paid in the Medicare tax. If you choose not to buy Part A, you can still buy Part B. So anyway, so here basically say for most people, the Part A is no premium. You don't pay premium because you worked over 10 years, you pay into the Social Security Medicare tax, okay? So then for people who didn't have that work, just remember, if you stay home mom, you didn't have those years, you are still qualified if your husband, have worked over, 10 years. So that's just something. For many single people, they didn't, pay into enough. So basically say if you pay less than 30 quarter pay into the system, then your monthly benefit is $471 per month. So if you paid into the system 30 to 39 quarter, your monthly benefit, your monthly premium is $259 per month. So that's just something cost. Just remember, for most people, your Part A is free to you. Okay, that is premium free. So here we want to talk about the Part A deductible and co-payments. Okay, so when you reach age 65, you signed enrolled in the Part A. So now you are insured. So when something happened to you, so you stay in the hospital, then your cost, how the cost, gonna be paid. So while the premium for the Part A coverage is typically without cost, there are deductibles and co-pays for service received. The primary expenses are related to the hospital stay. So you can see if it's anything else, because you have a Part B is a cover for the physician, for anything else. This one is mainly cover for your hospital stay. Say when the client is admitted in an inpatient. So each year a deductible is set per occurrence. You have to understand it's not per year, it's per occurrence of the illness. So which means that clients may pay this deductible more than once in a year if there's a hospital stay a minimum 60 days apart. Actually, you want this, okay? It seems that you have to pay, multiple deductibles. However, you want this. I will show you why you want this. So the deductible is charged, but there's no co-insurance for days basically the first 60 days. You have no co-pay. You can see that. Even each period you pay the deductible. The deductible I will show you is only the deductible is only $1,484 deductible, which means even you pay each deductible for the each period, but you have to know for first 60 days you stay in the hospital, you do not pay co-pay. So that's very important. Say for the hospital stays longer than 60 days, then all the way to the 90th day. So basically after 60 days, another 30 days, then you have to pay a co-pay. So co-pay for the 61 to 90 day is $371 per day. So that's your co-insurance for 60 to 91 days. So the co-pay increase after 91 to 150 days. They are considered lifetime reserve. So this one, so you better not increase to this one. Basically after 3 months, 91 days. So your co-pay is increased to 741 days per month. $742 per day. That's your co-insurance, basically from 91 to 150. So total is 60 days. They say 60 days is over lifetime. So if this one is lifetime, you allow 60 days, you have, so if you use deposits, then everything is beyond that is your pay, is cost to you. So basically, if a patient remain in the hospital more than 150 days within the benefit period, the total hospital costs beyond 150 days are responsibility of the patient. There's no limited number of the benefit period people can have during their life. So this is great news because you want the period, is based on the period. Even you pay the deductible for each period. So however, each new period, you will not pay copay. You will not reach your lifetime of those 60 days. So you can see here, there's a minimum 60 days apart. So if you get admitted to the hospital, you have to think it's a good idea for you to separate those period you want to, let's say you admitted for, January. If you get admitted again, make sure those apart is 60 days apart. So then you can avoid all the co-pays. Okay. So here this is the year 2021 number. I just want to show you example. Say in January 2021, you were sick and you were admitted in the hospital for 30 days. The hospital bill was $50,000. You can see it's $50,000. You only pay the deductible $1,484, and the remaining balance is $48,516. This is covered by the insurance, no co-pays. You can see the benefit. So if in July 2021 you got sicker, then you admitted to the hospital for another 80 days. You can see from the January 2021 to July 2021, you have more than 60 days apart. So this is a new period. You have to pay deductible, but you have to know you have no co-pays in the first 60 days. Say your hospital bill was $100,000 for the first 60 days and the $30,000 for the remaining 20 days. For the first 60 days, you pay deductible is only, $1,484. So no copay. So you basically, for your entire $100,000, you only pay $1,484. However, for the remaining, $30,000 in the 20 days, you have to pay copay $371 per day. The total for 20 days is $7,420. So the remaining is insurance covered is $22,580. So you can see how this works. If you have to pay deductible, it's great. Every time if you hear you pay deductible, which is good news to you because you do not pay copay. So that's just keep in mind when you in Part A, when you are admitted in the hospital. Okay, I'm going to talk about something else regarding the Part A. Say for the Medicare coverage, healthcare must be considered medically necessary and the service must be provided by the Medicare-approved facility. Home health care service may be covered. The primary requirements for the home health care coverage is that the care must be on a part-time and intermittent basis. So that's just some, you have to be approved, Medicare-approved facility. So those things, you have to look into it in the Medicare.gov website. So if you need those things to be approved. So qualified expense includes skilled nursing cares, home health aides, physical and occupational therapy, speech pathology, and Medicare social service. Doable Medicare equipment may also be covered. Part A also provides some hospice care. Limited skilled nursing benefit may also be approved under the Part A. Medicare only offers limited coverage under Part A for the expenses related to the long-term care. The insured must first stay in the hospital for at least 3 days and must also expect to cover from the medical condition. Then within the 30 days, the individual must enter the Medicare-approved nursing home, also as long as the care is provided at a skilled nursing level. The benefit may be available for up to 100 days. Skilled nursing care essentially means that the registered nurse is available and supervised the care 24 hours per day, and the care is required by the physician. If this is the case, the first 20 days in the facility are fully paid by the Medicare. The next 80 days are also covered with daily co-insurance. This is established every year, 176 days in 2020. After 100 days, the insured pay all the cost. So basically, say Part A covers some of the long-term cares up to 100 days. First 20 days is fully covered. Then later the 80 days, you have to pay $176 per day for co-insurance. So that's just keep in mind. So what else being covered in Part A? If you want more information, you should go to the Medicare.gov, look up those information yourself.